Hello, good day again. Nice to be here with you. I hope you're happy to see me. Today, we're going to be looking at another wonderful topic, and it is going to be something very interesting. And it cuts across both adults as well as children. And the topic is prevention of STIs and HIV/AIDS. Prevention of STIs and HIV/AIDS. We are all actually intermingled with people, and it is very, very much important that we take note of some of these diseases that can be contagious or that can be infectious. Today, we're going to be looking at several contents in this particular topic. We're going to be talking about meaning of STIs and HIV/AIDS. We're also going to be looking at the safe age for reproduction. We're also going to be looking at signs of AIDS. We're going to be looking at the cure of the HIV/AIDS. And we're also going to be looking at myths or mites and facts about HIV/AIDS. Most persons have some pretty, like say, some information, I think, or a kind of a knowledge about HIV and AIDS, and they believe it is correct. So we're going to be addressing so much of those information or ideas. And then also we're going to be looking at how to detect the HIV/AIDS. We're also going to be talking about ways through which AIDS can be transferred so that you can actually apply preventive measures, which are the precautions against STIs and HIV. And then we're also going to be looking at counseling and testing for HIV/AIDS. We're also going to be talking about the place of counseling in case someone is actually infected with it, the place the person should go for counseling. And we're also going to be looking at some advantages of what we call post-test professional counseling. Why is this counseling of benefit to us humans? And then finally, we're going to be looking at community care and support for those living with the HIV/AIDS and the virus and all that. So these are the things we're going to be looking at in this particular topic on prevention of STIs and HIV. Now, to begin with this, I would want us to first of all look at the meaning of STI. Now, STI simply means sexually transmitted infection. We also have words like STDs, which also has to do with sexually transmitted diseases. Now, sexually transmitted infections are actually results in diseases that can be contracted through sex or through sexual activities, or I can call them biological intimacies. Now, there are different examples of STI or STDs. Now, we have examples like the syphilis, which is caused by a bacteria called Treponema pallidum. We also have the gonorrhea, which is also another STI. We have the herpes, we have the chlamydia, we have the candida, and as well as the HIV/AIDS, stroke AIDS disease. These are some of the diseases that can be transmitted through sexual activities or sexual contact. Now, what exactly is HIV? What is HIV? We're going to be looking at the meaning of HIV. We're also going to be looking at the meaning of AIDS. Please take note the two words are actually different, and one of their differences is that they are not spelled the same way. Also, we're going to be looking at some other differences between the HIV and the AIDS. Now, HIV simply means, what I call it is an acronym. It simply means human immunodeficiency virus. Human, that is the H. Now, the human simply means that it attacks human. Now, immunodeficiency simply talks about it affects the immune system, or it weakens the immune system. It makes the immune system not to actually do its normal work, to work properly. Okay, and then we said V is virus, and it simply means it is a virus. Now, it is actually the HIV that causes AIDS, or that gives rise to AIDS. So HIV is a virus that it destroys the immune system, thereby making it susceptible to diseases. It makes it open to every kind of disease. Why? The immune system has been weakened or actually destroyed. All right. So that is what we mean by the HIV. Now, what is AIDS? As an acronym, also, AIDS can simply be defined as acquired immune deficiency syndrome. Acquired A, immune DMI rather, and then D, deficiency, and finally S, syndrome. Now, this simply means that AIDS is actually a disease. So it is the HIV virus or HI virus that causes the AIDS. Now, we said that A simply means acquired. This means that this disease can be acquired. It can be transmitted from one person to another. Remember, we talked about the H in HIV. We said it is human. That means it attacks human. So the acquired means it can be gotten, or it can be gotten from one person, or transmitted rather from one person to another. And then we have the I and D, which is immune deficiency. It simply means that the HIV virus attacks the immune system and makes it deficient, or destroys it, or makes it very weak. Now, syndrome talks about or refers to the virus or to the disease that it is just a singular disease, but it has several symptoms. It simply means that the symptoms are much. You see several symptoms, of which we're going to be looking at much later in this particular topic on prevention of STIs and HIV/AIDS. Now, please take note again. It is the HIV that causes AIDS. And HIV simply means human immunodeficiency virus. And then the AIDS simply means acquired immune deficiency syndrome. Now, what exactly is the safe age for reproduction? Remember, we said something about one of the STIs. STI simply means sexually transmitted infection. And we say it leads to STDs, which are diseases that can be contracted through sexual activities. Now, what is exactly the safe age for sexual activities, or probably leading to reproduction? Now, there are several things one should ask themselves when actually wanting to indulge in reproductive activities, or if I can say biological intimacy. Now, that a child, probably in his teenage age, physically might look mature, but emotionally and psychologically, that child might not be mature enough to take responsibilities. So what are some of the guidelines in terms of questions that should be asked by individuals when they want to go into such activities? Now, one of the things, simple question, I'm just going to give you 3 simple questions you should ask. One of them is, are you mature enough physically, socially, and emotionally? Are you actually mature enough physically, mentally, or psychologically, socially, and emotionally? Number 2 is, have you finished schooling? Because these are some of the distractions that actually make people don't achieve their goals in terms of career focus, or in terms of career visions. So it can also bring a cut short, or it can cut short your ambitions or your focus in life. Number 3 is, do you have a good job? Because actually you need enough finances, you need a good job to take care of the family you are about to start raising up. You need a good job. You need finances to actually help you take good care of your family, or the family you are actually wanting to raise up. No, there are several young ladies and probably young men out there having families they actually didn't plan for. And you see most persons on the street with babies, or young girls with babies on the street begging and all that. Now, that was because they didn't take note of themselves as physically ready, emotionally ready, psychologically ready to carry out those responsibilities. I pray this will help someone. Now, the next thing is signs of AIDS. Signs of AIDS. Now, what are actually the signs? Now, AIDS have a kind of negative effect on the body system. Remember, we said that it affects the immune system. And when the immune system is actually down, it means that the body's defense is also shut down. It's also brought down. And when the body's defense is down, it means that every microorganism or any pathogen or germs can come and create an effect which can be seen as several symptoms in the life of that particular victim. Now, let's take a look at some of the signs or some of the symptoms of AIDS. Number one is unexpected weight loss. As you can see on the screen there, which you can check the difference between a man before he had the HIV virus and then the man after he has been pronounced HIV positive. You can see that there was actually weight loss, unexpected weight loss. Number two is that the person gets tired easily, And there is also persistent fever. There is severe diarrhea that can even occur for months. And there is also, in some way, loss of hair and pneumonia and so many other symptoms and signs that will be noticed when the person has been pronounced HIV positive or has the HIV virus. Now, the next important thing again is myths and facts about HIV. Now, I told you that several persons have different opinion, different idea about HIV, which most of them are not correct. Now, in this particular presentation, I just want to highlight one or two important opinion, suggestions, and idea people have about the HIV or HIV and AIDS. Now, the first one is that they believe that HIV is the same as AIDS. And I believe I have clarified that. HIV is not the same thing as AIDS. HIV is a virus, the virus that causes AIDS. And AIDS simply means acquired immune deficiency syndrome. Now, the second myth or might that people have about the HIV virus is that the HIV AIDS is a death sentence. Now, actually, it is not a death sentence. And that's why most persons, when the news breaks out to them that they are HIV positive, due to their psychology and emotions, you will see that it starts affecting them literally. And most times, I believe that is what really results in the death of most persons. Now, and that is where counseling comes into play. We're going to be talking about counseling much more later. But note that the HIV AIDS is not a death sentence. There are several ways you can actually improve your health and be focused in your future. And that is the use of antiretroviral drugs. These are drugs that can help you put yourself together and still move on. Number three might is that a person can be infected by HIV through mosquito bites. Now, it is not possible for people to be infected through mosquito bites. Now, the HIV virus cannot be transmitted. In fact, doesn't work or doesn't, it's not active. It's not, it remains a non-entity inside of the mosquitoes, okay? So if a mosquito or mosquitoes, like the female Anopheles mosquito, the Colex, the Aedes mosquitoes, and so on, if it bites a particular person and goes to bite the other person, there is no transmission. In fact, none has been recorded so far. Number four might is that relatives and friends caring for HIV/AIDS infected persons will contract the disease. Now, the disease can be contracted through touch, through physical touch, through hugging, even through playing games with people. Now, it comes only by blood contact, which we're going to be looking at much later. We're going to be checking some of the ways through which these virus can be transmitted from one person to another. But please take note, HIV virus cannot be transmitted if you are caring for your loved ones that have the virus. If you're caring for someone that is your loved one and the person has the virus, that doesn't mean you will automatically have the same virus. It doesn't transmit that way. Now, the next one we're going to be looking at is the cure for HIV/AIDS. The cure for HIV/AIDS. Now, the truth of the matter is that researchers all over the world have tried their level best to see if they can come out with effective vaccines or whatever to cure the HIV/AIDS. But the truth of the matter is this: there has not been any significant success that have been recorded. So for now, the truth is that HIV/AIDS do not have any known cure scientifically, do not have any known cure. I repeat again, scientifically, all right? Now, the next thing to take note of is some of the myths I mentioned I didn't finish up. One other myth they say again is that I am straight. You know, most people believe that since they don't involve in illicit relationship, they are faithful to their spouse, they don't do drugs and all that, they can't contract the HIV/AIDS. Now, the truth is that even if you're faithful, even if you're not a drug abuser or a drug user, you can still contract the HIV/AIDS, or you can still contract the HIV virus. Now, we're going to be looking at more ways through which this transmission can occur. But number 6 says it is dangerous to live around HIV positive people. We've just established that it is not actually dangerous. It is not dangerous at all to live around people that have the HIV/AIDS. Now, the last one is that pregnant women that are infected with HIV/AIDS always pass it on to their children. Now, the word is always. Is always. Now, if it is always, it is then not true. Now, one reason is simple. The blood of the mother and that of the child don't mix, okay? They don't mix. And I think the placenta makes sure of that. The placenta ensures that the maternal blood and the fetal blood don't mix. And since it has nothing to do with the mixing of the blood, because one way through which HIV/AIDS can be passed on or transmitted from one person to another, it is through blood contact. Through blood contact. Now, whatever prevents blood contact also has a way of can be a preventive or a precaution against the HIV virus. So, if a mother that is a carrier of the HIV virus is well taken care of, follows the whatever the doctor tells him or her, or is taken care of by the doctor, well under observation of the doctor and that of the mother and the baby she's carrying in her womb, definitely there will be no transmission of the HIV virus from the mother to the baby if the doctor does do their work very well. Now, the next one is how to detect HIV. Now, how do we detect? How can you tell that someone is a carrier of the HIV virus? Now, if someone is a carrier, it doesn't show on the face. Now, it doesn't show until it develops to that point where it becomes AIDS, okay? When it becomes AIDS, where symptoms begins to show up, that is when the person can be certified to, can be seen by all to have had the HIV virus. Now, sometimes the HIV virus can be in a person's body up to 3, 4, 5 years without showing up, without showing anything. So it is very, very important for most times for people to run or go through tests. So one of the ways you can detect the HIV virus is through blood tests, running a blood test. That is one of the authentic way we can actually know if someone is HIV positive or HIV negative. Now, we have been talking so much about how HIV, the virus, can be transmitted from one person to another. Now, let's take a look at some of the ways through which transmission is possible. Now, one of them is through sexual contact. Remember when we started, we said that we're looking at STI, which is a sexually transmitted infection. And one of the sexually transmitted infection is the HIV, or one of the sexually transmitted disease is the AIDS. So through sexual contact. Now, number two is through transfusion of unscreened blood. Remember, I said that it is through blood contact. So when a blood is in contact, or when two bloods mix due to blood transfusion, and the one of them is not screened and happens to become a carrier of the human immunovirus, definitely there is going to be a transmission of that virus from the carrier to to the healthy person, and the healthy person ends up becoming a carrier. Number three way is through contaminated injection needles, and other sharp objects, playing with sharp objects, razor blades, pins, and all that. Now, these sharp objects, if not sterilized, please do not play with them, or even children do not go close to sharp objects or use them on your skin. And then number four is through pregnant mother to unborn babies. Yes, I said that the unborn babies can't get it because the fetal and the maternal blood don't mix. But if the mother, like I said also, is not well taken care of, and the baby, there is a risk. In fact, the baby stands the risk of becoming a carrier of the same virus that the mother carries. So if care is taken to the baby and also to the mother during the pregnancy and after the pregnancy, all right? So these are some of the ways through which the HIV virus can be transmitted. Now, quickly moving ahead, let's look at how to prevent this. It's not just enough knowing the negative effects, but how do we prevent it? It is preventable. That's the good news. It is preventable, and we can take precautions against the spread of STIs and also the HIV/AIDS. Now, one of the ways we can prevent this is abstinence. Abstinence from sexual activities when you are not married. Or, yes, abstinence from sexual activities when you are not married. Abstinence, in fact, is one of the key and most important ways to prevent sexually transmitted diseases or infections. Number two is couples should be faithful to themselves. If you're a couple, please be faithful to your partner. Promiscuity most times brings about the spread of sexually transmitted diseases. And then number three is use of sterilized sharp object. Remember, we just mentioned some of the ways through which HIV or STI can be transmitted. We said one of them is through the use of contaminated sharp objects, contaminated injection needles, and so on. Now, when they are properly sterilized, it cannot pose that threat. So use of sterilized sharp objects can also be a very good, effective way of preventing STI. And then finally, number four is proper screening of the blood before transfusion. Proper screening of the blood before transfusion. Please, if anybody wants to transfuse blood, or if there is any transfusion of blood in any way, please ensure that the blood is properly screened. Properly screened. For agglutination tests can be carried out. HIV tests can also be carried out. Proper screening of the blood before transfusion. Before transfusion. And then next we're going to be looking at is counseling and testing for HIV/AIDS. Now, remember, most times people feel counseling is most times done after a person is certified to be HIV positive. Now, it is not always. Counseling can come to people that are healthy to help them note some important keywords they can actually prevent being infected by sexually transmitted infection. So counseling is actually key, very key ways we can also control sexually transmitted infection. Now, what is actually counseling? Now, it involves a private conversation with a specially trained person aimed at helping an infected person manage the situation, to manage a particular situation. So, the person that is actually giving the counseling must be a professional. We must be a professional, someone that is specially trained to carry out these effects. And one of the things the person should do, or one of the qualities, is that the person should be confidential. You don't spread out most of the things they spoke to you in secrecy or in privacy. So the person, the specially trained person or the professional should be confidential. And most times, the exercise of counseling people with HIV is usually free. All right. Now, there are two kinds of counseling. The first one is what we call pre-test counseling, and the second one is what we call the post-test counseling. Yes, I believe you understand what it means by pre-test and then what it means by post-test. Now, when we're talking about pre-test counseling, we are actually looking at counseling with a professional before conducting the HIV/AIDS test. That is, before you go for the test. Now, it's very much important that you be counseled, you be talked to, and so that and what one of the things he might tell you, or she or the counselor might actually explain to you, it shouldn't be it should be a way to motivate you to actually go for the test, and also whatever the result is, for you to be able to manage yourself, okay, manage that particular situation. We also have the post-test, and your guess is good as mine. Now, the post-test has to do with counseling, okay, counseling from a well-trained person after the HIV test has been conducted and the result has been received. Now, I know some persons that have actually received results that they are HIV positive, and most of them end up, in fact, crushed within their spirits and so on. But that's where a counselor comes in to actually explain, to actually help these individuals that are being infected with the virus, to help them understand ways through which they can still move ahead in life. And it is not, like I said, it is not a death sentence. Now, what are some of the advantages of post-test counseling? Post-test counseling. Remember, we have two types, pre-test and post-test. So what are the advantages of post-test counseling? Now, one of the advantages of a post-test counseling is that it helps, excuse me, it helps the infected person to take charge of their lives and control their health. So they take charge of their lives and also control their health. Number two is that it helps infected persons to manage the impact of the disease on their personal lives, helps them manage it. And number three, it helps the infected persons plan for the future and still live a meaningful life. It is not the end. It is not a death sentence. So the person that is being infected or a victim can still live a meaningful life. And that's where the counselor comes in. And then number four, it provides the infected person with emotional and psychological support. So the counselor provides this support emotionally and also psychologically to help the person that is a victim to continue in life. Now, where do we get counseling? Where are the places certified for counseling? Now, please note that you are not a carrier of the virus doesn't mean you don't need counseling. Now, counseling, like we have seen, we said we have what we call the pre-post counseling, and then we have the pre-test counseling, and then we also have the post-test counseling. So you can go for a pre-test counseling. Now, one of the places where we can get counseling is the general hospitals. We have the health centers, we have maternity homes, we have sexual health clinics, we have teaching hospitals, we have HIV/AIDS centers, and so on. These are areas and places you can get counseling. All right. Remember, we said it's free, and also it is actually confidential. Is community care. Now, the should play a major role. In fact, they play a major role in supporting and caring for those people that are living with this virus, with the HIV. Okay. Now, these are some of the ways the community can actually show their care and also show their support. Number one is always encourage HIV/AIDS patients to get treatment, especially when they are sick. When they are sick, they can get treatments, they can get help from the doctors, from health centers, from teaching hospitals, and so on. And then number two ways the community can also show support and care is always show love. You show them love, you show them support, you show them respect, and then also you show them all this. Now, remember I said before that most of these persons that are victims of HIV doesn't mean they didn't mean that most of them were promiscuous or were sleeping around or actually were doing drugs and so on. Most of them were actually innocent victims. All right, they are victims that maybe through blood transfusion, okay, on screen blood transfusion, playing or actually using sharp objects, probably the razor blade and all that, and the person becomes infected through such means, or probably a child or a baby in the womb of the mother. And all these are several processes or several ways through which people can be actually infected. So please always show them love, always show them care, always show them support, and also respect them. Number three is balanced and nutritious meals should be made available to infected persons. Most of these infected persons have exhausted most times what they have. Most of them are actually poor. So at least providing or making available balanced and nutritious meal is also a way of showing love, also a way of showing support and care to these people that are infected with the virus. And then finally, help them reduce stress. And of course, one of the ways we can reduce stress is playing games. So one of the ways you can help them reduce stress is to play games with them. It helps take their mind off that condition or the situation they are actually in. So these are some of the ways the community can actually help, support, and show care to those that are actually living with the HIV virus. Remember, this is basic science we're actually looking at, and the topic again is prevention of STI and HIV/AIDS. This is where we're going to call it a wrap up in this particular class. I'll see you in our next video. Bye for now.